No, I don't think it's a mistake to try to do things in a coordinated way. This virus doesn't respect borders or boundaries, and so it makes sense, given the geography of the UK, that we try to coordinate. But as we have gone through this crisis and the virus has spread and developed at a slightly different pace in different parts of the UK, it's also been right that we have taken decisions and acted in a way that is tailored to our own circumstances, and that's been very important to me here in Scotland.
The reason I ask about that four nations approach is, of course, that Scotland, as you often say, is a very different country. We could be compared to Denmark, for example. Denmark has registered 593 deaths, as opposed to Scotland, which is 2,434. They locked down on the 11th of March. Scotland locked down on the 23rd of March. Shouldn't we have locked down earlier?
I think in the fullness of time, when we're through this crisis, I will want to look back, everybody will want to look back and say, did we do things at the right time? Did we do the right things, or could we have done things differently? But I'd make 2 points, I suppose, right now. Firstly, I took, and I think all of us have tried to take, the decisions we thought were right at the right time based on the best advice and evidence we had. But the second point I would make, when there are comparisons being made between different countries on deaths or anything else, we are not through this pandemic yet. Some may argue we're not even halfway through.
No, but Denmark is heading out of it, having locked down earlier.
But the point is, what I'm saying there is, you could argue they're coming out of the first phase of it. None of us are through this pandemic. And the point I'm making, and it's not a defensive point, because I've been very frank all along, we will all have made mistakes here, and I will want to learn from those mistakes. But I think it is premature for any country to be declaring success or victory in this, or to make definitive comparisons.
You say that you were doing the best with the advice that you had, but you were warned about care homes. Professor Richard Enos from the School of Biological Science at Edinburgh said he wrote to your health secretary before the lockdown and recommended shielding care homes. That didn't happen. He says this was a huge and fundamental mistake in public policy.
I don't agree with that, but and I'll set out why. But equally, I want to preface all of my answers to your questions here with a couple of things. I regret every single death from this virus, and I particularly regret deaths in care homes. It upsets me deeply, it upsets everybody deeply.
I mean, 47% of all deaths in care homes, more than any other setting.
If you don't mind, if I can, because it's a serious point. The percentage of deaths in care homes in Scotland, just to make this point, is actually broadly in line with other countries, far too high. Yeah. But right from the outset, we took a decision about isolation, infection prevention and control. We put in place guidance for care homes. And yes, we tried to make sure that people weren't being delayed in hospital when we were expecting a tsunami of coronavirus into hospitals. So it wouldn't have been necessarily safe for older people in hospitals.
921 people, older people, were transferred out of hospital to care homes. Do you regret that?
Look, I regret the number of people who've died in care homes, but again, what I'm trying to say here, and it's an important point, and I don't want it to sound defensive, because I agonise over all of these things literally on a daily basis.
But we shouldn't put anyone in a care home, should we, who was vulnerable from hospital?
But this is the point I'm about to make. The people you are talking about shouldn't have been in hospital because they were so-called delayed discharges. They had no medical need to be in hospital. Now, if we look back with hindsight, and it's easy to apply hindsight, had we left older people in hospital, we would probably be facing criticism, because they would also have potentially been at risk of getting the virus in hospital. So I think all of us have to learn so much from this, but it's too easy for people who weren't taking the decisions to apply the knowledge that we have now to the decisions we were taking back then.
On the 18th of May, your health secretary said that all staff in care homes would be tested weekly for coronavirus. You know, you've heard about this today. Almost a month has gone by. Only 20% have.
So these things do take time to put in place, and I get frustrated that we can't do these things more quickly, but we are putting in place systems that have to be not just robust, but sustainable over a period of time.
But it's so slow.
Well, I want it to be quicker. We are seeking to accelerate that. We are publishing data starting today, every single week, broken down by Health Board, that will show the progress of that.
Is this the hardest thing you've had to do as First Minister?
Without a shadow of a doubt. But in every sense, this is the hardest thing that I've had to deal with. And I suspect for every serving leader, or almost every serving leader anywhere in the world right now, that would be the same conclusion.
But of course, it doesn't knock out other things you have to do. And let me turn to Brexit. What will be the impact on Scotland if, as the Prime Minister insists is going to be the case, there will be no extension, and then if there is no EU trade deal by the end of the year, what will the impact be in Scotland?
Pretty catastrophic, and I think that will be the impact on the whole of the UK. And I would have said that pre-COVID, but to add that impact onto the economic impact of what we're dealing with the virus just seems to me to be an unthinkable thing to do. And so even at this late stage, I would appeal to the Prime Minister not to allow that to happen. For goodness sake, our economy is already going to be struggling for some time to come with the impact of the virus. Do not add on economic suffering to economic suffering.
That would not be, as it were, a four nations approach. That is an approach where you want to be saying, presumably to Boris Johnson personally, deal with this a different way.
I think Boris Johnson knows, if he has been listening at all over the last few years, my view on Brexit and a no-deal Brexit, that
but
he should not contemplate that.
Since what, 29th of July or something last year?
Look, I can't remember the last time I saw Boris Johnson. Look, it takes two people to make a relationship work, and I've gone out of my way, not for any reasons other than I just wanted to focus entirely on my job and my responsibility during coronavirus. I'm not criticising others for the decisions they're taking.
When are you actually going to lay out a roadmap for another independence referendum?
Look,
sadly for coronavirus, nothing is on hold.
Sure. Well, actually, for me, everything other than coronavirus right now is on hold, and I'm going to continue to focus on coronavirus for as long as I need to. That is my total focus right now.
But of course you have a recent opinion poll which does put, and you can't ignore that, support for independence on the rise, 50%, 52% precisely for independence. You can't ignore that. That's a trajectory presumably towards another referendum.
Well, look, I think Scotland will become independent. I think there is rising support, as you've just demonstrated to me, for independence. And I think the way I continue to demonstrate that Scotland should be independent is to do everything I can to show that a Scottish Government is best placed to take the big decisions that matter for Scotland.
Some argument that's just raging just now is over statues and place names. Let's just deal with that briefly, sparked by the death of George Floyd. Scotland, as you know, is littered with memorialisation. I mean, your own official residence at Bute House isn't immune. It's got direct links to slavery. But rather than your Justice Secretary saying it should be the responsibility of councils to take statues down, shouldn't there be a national review instigated by the Scottish Government?
Yes, very possibly, yes. So I'm not, I think Hamza was rightly stating the law and the facts of the matter, but I do think we should have a long, hard look, or perhaps not that long a look, but a hard look at this as a country. And the question I would start with is, why do we want to continue to have statues and celebrations of people and street names of people who profited in and traded in abject human misery? This is a big debate and long overdue debate, and yes, I think there is a role for the Scottish Government to lead that discussion, which we will certainly seek to do.
One other issue you're facing is the fallout from the Alex Salmond trial. The former First Minister was acquitted of all charges of inappropriate behaviour and sexual misconduct. He was a former close friend and mentor of yours, and I wonder what you felt like when you heard the verdict.
The day I heard the verdict, I was immersed in dealing with coronavirus, and I'm not trying to kind of dodge the question, but actually I was. Most of my, pretty much all of my thinking that day and in the days leading up to that and in the days since have been about coronavirus. Look, there's going to be inquiries, parliamentary inquiries, where I'll have the opportunity to have my say and be asked questions and scrutinised, and I'll deal with that in the fullness of time.
But just one more on that. More people are becoming vocal, alleging conspiracy around people close to you to bring him down. So what do you say to that?
There was no conspiracy. It's a heap of nonsense. But I'll, as I say, in the fullness of time, get the opportunity to elaborate on that view.
So finally, Boris Johnson says that he is proud of his record on the coronavirus. Is that something you would say?
It's not words I would use, because I don't think anybody in any country right now where there have been people dying could say or should say that they're proud of that. I've tried to do my best at every turn. I'll have got hopefully lots right. I will undoubtedly have got some things wrong when we look back, and I will not shy away from being candid about that. But I deeply regret that we've lived through this. I deeply regret that so many people have died, and I think the sorrow and the anguish of all of this will live with all of us for a long time to come, and some of what I've been dealing with as First Minister over the past few weeks, I know will live with me for the rest of my life.
First Minister, thank you.
Thank you.